Hi, good morning, friends. Today we are going to talk about the straight narcotic preparation, exempted narcotic refill versus part pill transfer, and the sales report. So these are the terms which are very important in the PEBC exam, and you can have 1 marks for sure if you totally understand all these terms, because there are so many questions, not so many, just 2 or 3 out of 200 questions in pharmacy practice area. Requiring a strong understanding of these terms. So without wasting any time, let's jump on the straight narcotics. So what are the straight narcotics? Okay, now let's discuss about the straight narcotics. So what are straight narcotics? So let's do one by one all 5 points. So the all single entity narcotics, which is simply the single narcotic medication, which is known as straight narcotic. There is no combination with the with any other medication like other non-narcotic ingredients. So if there is only one single entity and it is narcotic, then it's straight narcotic. Okay, let's do the second point now. All narcotics for parenteral use. So the narcotics used for like IV administration or intramuscular right away becomes a straight narcotic. So the third point is all narcotic compounds containing more than one narcotic drug. So if you see the combination or the compound having 2 or more than 2 narcotic ingredients, it becomes the straight narcotic simply. So that talking about the fourth point, all narcotic compounds containing less than 2 is a keyword. All narcotic compounds containing less than 2 other non-narcotic ingredients in a therapeutic dose. So if we put it simply, it is 1 plus 1 combination. So one is narcotic ingredient and the second one is non-narcotic ingredients. So if you see the one is narcotic, the second one is non-narcotic. For example, codeine plus acetaminophen. So codeine is narcotic, acetaminophen is non-narcotic. If you see any combination having one narcotic and the one non-narcotic, it becomes the straight narcotic. Let's come towards the fifth point, which is very easy and straightforward. Narcotic having the presence of heroin, oxycodone, hydrocodone, methadone, and the pentazocine. So if you see the presence of any 5 of this medication, the compound right away becomes the straight narcotics, because I think these are the very potent narcotics. Okay friends, let's talk about the narcotic preparation now. So what is the difference between narcotic preparation and the straight narcotic? So in the straight narcotic, like I mentioned in the previous slide, if there is a combination of 1 plus 1, one narcotic, one non-narcotic, it is known as a straight narcotic. But here you can see there is one narcotic ingredient and 2 non-narcotic ingredients. So it becomes the narcotic preparation. So if you see the combination of 1 plus 1, it is straight narcotic. And here is 1 plus 2, 1 narcotic and 2 non-narcotic. So that becomes narcotic preparation. And these are also known as verbal order narcotics. So the prescription can be given verbally. So most often if you are working in the pharmacy, you can see the dentist are sending the verbal prescription for Tylenol number 3, because this is the preparation. The straight narcotic, the doctor cannot send the verbal prescription, or doctor cannot give the call to the pharmacist for verbal order prescription. But for the narcotic preparation, in case of Tylenol 3, like I mentioned in the dental tooth extraction procedure, among with the amoxicillin, Tylenol 3 is given for the pain. So Tylenol number 3 is codeine plus caffeine plus acetaminophen. So codeine is a narcotic, caffeine is non-narcotic, acetaminophen is non-narcotic. So here is a combination of 1 plus 2 that makes narcotic preparation. So that should be clear. Okay, now what are exempted narcotics? So exempted narcotics are simply the narcotic having the presence of codeine less than 8 mg. So this is the standard amount 8 mg, less than 8 mg, which makes the preparation or the compound as exempted narcotics. So as you know, the codeine is like a very risky kind of ingredient. Sometimes it can cause a serious kind of allergy to some individuals. But 8 mg is not a huge amount that you should be scared of. So if the codeine is less than 8 mg, the compound becomes the exempted narcotic. Likewise, in the liquid preparation, if the codeine is less than 20 mg per 30 ml, so if there is a liquid preparation and having the codeine less than 20 mg in 30 ml, that preparation is also exempted narcotics. So you don't need a prescription to get those preparation. You can just simply ask the pharmacy technician that I need the Tylenol one is an example of the exempted narcotic because it has the codeine. It has the amount of codeine 8 mg. So doesn't require any prescription. This is the Schedule 2 behind the counter medication. So if somebody asks for Tylenol number 1, the pharmacist intervention is required, but the prescription is not required. So this can be given without prescription. So exempted narcotics doesn't require prescription, which is most important point. And this is Schedule 2, which is behind the counter as well, and requires pharmacist intervention. So the pharmacist must be present in order to ask some question to the patient that have you ever taken this medication before, like that. So only pharmacy technician or only the pharmacy assistant cannot sell this medication without pharmacist intervention. So these are the points should be kept in mind dealing with the exempted narcotics. Once again, codeine should be less than 8 mg in the solid, like the tablet, and the codeine should be less than 20 mg per 30 ml in the liquid preparation in order to become exempted narcotic. Okay friends, now let's do the comparison between straight narcotics and narcotic preparation. So straight narcotic medication should have the written prescription only. We cannot take the verbal order. Narcotic preparation can be written or the verbal prescription, that's fine. For straight narcotics, there should be no refills. For the narcotic preparation also, there should be no refills on the prescription. So it is really important to understand the difference between refill and part pill. So for example, if the medication is prescribed and the original quantity, for example, is 90 pills, and there are 3 refills on top of that. So initially we can give 90 pills, and then whenever the patient is out of that 90 pills, we can start giving the refills. So we can give the 90 pills initially and then 90 pills 3 times. So that makes 360 pills altogether, which can last for at least a year. This is the case for the non-narcotic medication like the Schedule A drugs. But in case of the narcotic, we cannot dispense more than the original quantity prescribed. And in other words, you can clearly see the refills 0 on the prescription. So, for example, there is a narcotic medication. The patient is giving the prescription for the narcotic medication, and the original quantity is 90 pills. Then you can break that quantity in 3 parts, for example, like 30 pills a month. So that is known as part pill, because you are not giving any quantity top of the 90 pills, which is refill, but you are breaking the original quantity in 3 parts, like 30 pills, 30 pills, and 30 pills. So this is known as part pill, and which is allowed. And normally we have the clear instruction from the physician or the prescriber that you can give the part pill this quantity. So refill is the top of the original quantity mentioned, and the part pill you can break the mentioned quantity in some parts. So part pill and the refill. Okay, now let's talk about the transfer. So let's understand what the transfer is. So if the patient is moving from one town to other town, obviously he or she will not able to come and get the medication from the existing pharmacy, because they are moving to the far places. Now, what the pharmacies can do, the patient is moving to the new town, and the new town pharmacy can contact the previous pharmacy of the patient and can get the full medication list transferred to the new location. And in that process, the straight narcotic or the narcotic preparation cannot be transferred, because these are the very highly regulated medications. So patient need to go to the doctor and get the new narcotic prescription if it is required, but that cannot be transferred from one pharmacy to other pharmacy. Okay, now let's talk about the sales report. Sales report should be kept for 2 years in case of straight narcotics, but there is not any requirement in case of narcotic preparation. So I hope you all understand these things. Okay, here is a very important table for the exam. It shows the difference between Tylenol types. So Tylenol number 1 has 300 mg acetaminophen, 15 mg caffeine, and 7.5 mg codeine. So the 7.5 mg codeine, which makes it less than 8, and which makes it exempted medication, which can be dispensed behind the counter without prescription. Tylenol number 2 is 300 mg acetaminophen along with 15 mg caffeine and 15 mg codeine. So that is a narcotic preparation. Here you can see the 1 narcotic and 2 non-narcotic. Codeine is narcotic, and the acetaminophen and caffeine are non-narcotic. So this is 1+2 combination, which is a narcotic preparation. Same with the Tylenol number 3, which is narcotic preparation. And the Tylenol 4 is an exception, because here there is no caffeine present. So it is only 1+1 combination, like 300 mg acetaminophen and 60 mg codeine, which makes it a 1+1 combination, which is straight narcotic. And the straight narcotic medication need a written prescription, not even the verbal. So this is the clear difference between these 4 types of Tylenol, and which is exam oriented, very high yield information.